It was an early morning in Rio de Janeiro on the beach, about 10 o'clock. And my two friends and I went out on the beach and we're laying out in the sun, and I got hot and I said, does anyone else want to go catch a wave? And no one else wanted to go in, and the third wave I caught was about 10 or 12 feet high. It collapsed into 3 feet of water. I can still vividly remember hitting the bottom and knowing I'd been stunned and hit the bottom and tried to push off the bottom and couldn't push off. And then the next wave went over and I couldn't kick off the bottom. And at that point, the fear set in of, I'm gonna drown.
It was morning and it was at 10 o'clock. And I was in the basement sanding on a brass bowl that we're gonna use in a fireplace and put rocks in and have a fire there. And for some reason, Alana was still there. And so when I got this boy's message, I said, Alana, get on the phone. I was down in the basement, and I hollered up the steps to her. And, it's that call that you never want to get. You just never want to get it. And I can walk down the halls here, and I can tell you a new parent. I mean, I can see them. I've been there. I look the same way.
You know, it was the call that every family remembers who's ever had some family member injured. It's the call from hell. Injury happened October 21st, and December the 6th, we arrived at Piedmont.
And they had already put together a team of doctors, from a group of orthopedic surgeons to a pulmonologist, a thoracic surgeon, neurologist. So they wanted to treat it as a team because they knew how complicated it had gotten. And we thought if we got back to Piedmont and our family and our doctors, everything would be fine. And it was sort of fine. It was a pretty rocky road. I spent a few more weeks in ICU and had some respiratory arrest, cardiac failure. So it was a pretty rocky landing even coming back home.
There was a lot of doubt about whether he would live or not, as you can imagine. So we heard about the hospital in Denver, and Harold went out there and looked at it and came back that same day and said, this is so different. It's really what they call spinal care. And so he said, let's get out of here. And they said, oh, no, you can't possibly leave. No. It'll be six or 7 months. We need to build him up with blood transfusions and all this sort of thing. We said, no, we're going. And then they began to come around one by one to us and say, you're really making the right decision.
And it was just like you flipped a light switch. It was night and day.
He began to move a toe and then a finger or so, and when we got out there, he was coming off his ventilator, and they began to pull all the tubes and get you knowing that there's some hope, and a lot of intense physical therapy and so forth. So lucky that he was an incomplete injury, so he got return of function and sensation, particularly on one side, and he was able to walk out with a leg brace and a crutch. Well, that was a great day.
Everybody said, there should be something like Craig in the Southeast.
He said, oh, somebody ought to start something. And yeah, somebody ought to start something. Somehow that somebody became us.
Partner of mine who was a friend of the Shepherds knew they were looking for a medical director for something they wanted to start. And he gave them my name, and they called me up and said, would you be willing to consider starting a rehab center? And I knew it would go right from the start because there was nothing available within a short airplane or long airplane ride from Atlanta.
We had begged every friend we knew and some that we didn't know too well for money to buy into this dream, and no one in Atlanta really understood what we were trying to do. So it was like, would you make a contribution, see if we can pull this thing off. And we started with 6 beds in August of 1975.
It became obvious so quickly that they didn't have the facility to cover all the patients' needs.
It was so wonderful to go in where everything was brand spanking new. The rooms were fully accessible, the facility was fully accessible, And we had a staff that knew how to take care of patients with spinal cord injury in an expert way. So just having your own home was worth it all.
And what's wonderful about this Shepherd is it's not like a hospital. It's not depressing. Everyone has a smile on their face. It's really like they say, like a big family.
Almost every day somebody stops you in the hall or the elevator and said, "Thank you for starting this place." Well, you know, I'm not the only one that started it. There were 4 of us in the beginning, and then lots more people were part of it. I couldn't do anything better with my life.
It's been 40 years. We've had a few bumps in the road, but you're going to do that if you do anything that's worthwhile.
I think one of the things that's most important to me is touching the people that come through the doors here and watching them leave with a smile on their face and hugging staff and saying how grateful they were to have been someplace during one of the most horrible times in their life, and they're ready to re-engage. It's just it's moving every day.